Did you realize that diabetes often remains unnoticed? It's akin to a hidden stream quietly coursing through your body. The symptoms that appear at night are the initial signs indicating potential issues before they escalate into a significant problem. In this video, we will explore 7 subtle indicators that manifest each night, suggesting that something may be amiss, with diabetes being a probable cause. Stay tuned until the end to identify all the symptoms and receive practical tips for effectively managing diabetes. Let's get started. Number 1. Restless leg syndrome. RLS is a neurological disorder that causes uncomfortable sensations and an irresistible urge to move the legs. This condition can disrupt nighttime sleep and diminish quality of life. Research has shown that individuals with type 2 diabetes may be at a higher risk for developing this syndrome. When it comes to managing restless leg syndrome, RLS, especially in individuals with diabetes, various treatment options can help alleviate symptoms and improve quality of life. Here are some effective strategies. Regular exercise. Engaging in moderate physical activity can help reduce RLS symptoms. However, avoid vigorous exercise close to bedtime. Balanced diet. Ensure a diet rich in iron, magnesium, and folate. Foods like leafy greens, nuts, and legumes can be beneficial. Limit caffeine and alcohol. Reducing or eliminating these substances can help decrease RLS symptoms. Diabetes management. Proper management of blood sugar levels through diet, exercise, and medication can reduce nerve damage and improve RLS symptoms. Iron supplements. If iron deficiency is present, supplements may be recommended after consulting a healthcare provider. If you or someone you know is experiencing RLS, it's essential to speak with a healthcare professional to determine the best treatment plan tailored to individual needs. Regular follow-ups can help monitor progress and make necessary adjustments to the treatment approach. Number 2. Night sweats. A silent warning from your body. During sleep, your body is meant to be in a state of relaxation and balance. However, if you frequently wake up in the middle of the night drenched in sweat, it is not just a random occurrence. One possible cause of night sweats is a significant drop in blood sugar levels. When this happens, the body releases adrenaline to raise blood sugar levels, which in turn increases heart rate and stimulates the sweat glands, leading to excessive sweating. Additionally, this phenomenon may be linked to nerve damage associated with diabetes. When the nerves responsible for controlling sweat glands are affected, the body's ability to regulate sweating may be disrupted. If you often experience night sweats, consider monitoring potential underlying factors. Start by checking your blood sugar levels before bedtime. Research suggests that stable nighttime blood sugar levels should range between 90 and 130 mg per deciliter. You may also benefit from having a light snack before bed that includes low glycemic foods, such as a slice of whole grain bread with a small amount of peanut butter. Lastly, if night sweats persist, consult a healthcare professional. Your doctor may recommend an HbA1c test to assess your average blood sugar levels over the past 3 months or conduct a nerve function evaluation to check for possible diabetes-related complications. Number 3. Leg cramps. A sharp pinch disrupting your sleep. Sudden, painful muscle spasms in the legs can be more than just an inconvenience. They often signal an underlying issue. One common cause is an electrolyte imbalance, particularly a deficiency in essential minerals like potassium, magnesium, or calcium, which diabetes can interfere with. Another potential culprit is peripheral neuropathy, a frequent complication of diabetes. When the nerves in the legs become damaged, they may send incorrect signals to the muscles, leading to involuntary cramping. This not only causes discomfort but can also significantly disrupt sleep. Poor circulation is another factor contributing to leg cramps, especially in people with diabetes. When blood vessels struggle to deliver adequate oxygen to the leg muscles, they may react with sudden, intense contractions, particularly at night when the body is at rest. To help prevent leg cramps, ensure your diet includes sufficient amounts of essential minerals. Incorporate potassium-rich foods like bananas, sweet potatoes, and avocados, while increasing magnesium intake through leafy greens, nuts, and whole grains. Additionally, performing a few simple calf stretches before bedtime can improve circulation and reduce cramping. A helpful exercise involves standing about a foot 30 centimeters away from a wall, placing your hands on it, and leaning forward to stretch your calf muscles. Number 4. Sleep apnea, a disruption of breath. Sleep apnea is more than just occasional gasping for air during sleep. It is a condition in which airflow to the lungs is temporarily obstructed, depriving the body of oxygen. For individuals with diabetes or those at risk, sleep apnea is not an isolated issue. It can significantly impact overall health. When oxygen levels drop, the brain sends emergency signals to wake the body up and restore breathing. This cycle of repeated awakenings throughout the night can lead to poor sleep quality and an increased risk of blood sugar imbalances. Moreover, sleep apnea is linked to higher insulin resistance, making diabetes more difficult to manage. It can also place strain on the cardiovascular system, elevating the risk of high blood pressure, heart disease, and serious complications such as strokes. So, what steps can you take? Start by identifying common symptoms of sleep apnea, such as loud snoring, sudden awakenings, or a choking sensation during sleep. Additionally, lifestyle changes play a crucial role in managing this condition. If you are overweight, consider weight loss, as excess fat around the neck can put pressure on the airway, worsening sleep apnea. If you found this information valuable, please give it a thumbs up. Your support helps us spread awareness and empower more people to take charge of their health. Number 5. Frequent nighttime urination. The endless journey to the bathroom. Frequent urination at night shouldn't be a random occurrence. When blood sugar levels rise, the kidneys work overtime to filter and remove excess glucose through urine. This process can lead to increased urination, even during the night. As a result, not only do you experience fatigue, but you also face the risk of dehydration and electrolyte imbalances. Additionally, nocturia, frequent nighttime urination, can be linked to other complications, such as kidney dysfunction, a common issue for those with diabetes. The ultimate consequence is disruption to your natural sleep cycle, leading to sleep deprivation, which can negatively impact your overall health and make it harder to manage blood sugar levels. When the kidneys become damaged, their ability to concentrate urine diminishes, causing more frequent trips to the bathroom. To reduce nocturia, start by managing your water intake in the evening. Ensure you're drinking plenty of water during the day, but limit your intake 2 to 3 hours before bedtime to reduce pressure on the bladder. If symptoms persist or worsen, it's important to consult with a healthcare provider to assess kidney function or evaluate the bladder to determine the underlying cause. Number 6. High blood pressure in the middle of the night. Typically, blood pressure drops slightly during sleep, allowing the body to rest and regenerate. However, if blood pressure remains elevated, or even increases, throughout the night, it suggests an imbalance in the body's regulatory mechanisms. For individuals with diabetes, this condition is often linked to damage to the autonomic nervous system, which controls vital functions like heart rate and blood pressure. Additionally, high nighttime blood pressure can be triggered by an increase in stress hormones, such as adrenaline. These hormones are often released when blood sugar drops too low, hypoglycemia, or spikes suddenly during the night. These fluctuations not only put extra strain on the cardiovascular system but also disrupt sleep, leading to fatigue and deteriorating overall health. Nighttime high blood pressure is a significant risk factor for serious complications like stroke, heart attack, or kidney failure, especially when combined with diabetes. To minimize this condition, start by monitoring your blood pressure at night if you suspect an issue. Use an automatic blood pressure monitor that records data, which will help you and your doctor track fluctuations more accurately. Additionally, reduce your salt intake and avoid processed foods at dinner, as they can raise blood pressure. Steer clear of caffeine or stimulants before bed, as they can increase both heart rate and blood pressure. Number 7. Morning headaches. The painful morning greeting. When blood sugar drops too low, the brain doesn't receive enough energy, leading to headaches in the morning. This is often accompanied by other symptoms, such as fatigue, sweating, or shakiness. Morning headaches can also be linked to sleep apnea, a common sleep disorder among people with diabetes. When the airway is blocked, oxygen supply to the brain decreases, causing headaches and fatigue upon waking. Additionally, dehydration or electrolyte imbalances during the night, often caused by frequent urination due to diabetes, are common triggers for early morning headaches. To reduce morning headaches, create an optimal sleeping environment to minimize the risk of sleep apnea. Keep the bedroom cool and quiet, and avoid stimulants like alcohol or sedatives before bed. Drink enough water throughout the day and limit excessive fluid intake in the evening to reduce the risk of dehydration. If you frequently experience electrolyte imbalances, include foods rich in potassium and magnesium, such as bananas or leafy greens, in your diet to help address this condition. If you found this information valuable, please subscribe to our channel for more life-saving content. Your support helps us spread awareness and empower more people to take charge of their health. Stay safe and happy. Thanks for watching.